Thank you very much for tuning into how she's going to weasel herself out of this one. So basically, the file is open. So that's number one, right? That's the first step into legitimizing this whole thing, right? So the whole point is that, yes, this is a real thing in any sane and civilized society. This would be a capital murder case. But anyway, we're going to try for this, noxious substance and gross medical negligence causing death and all this stuff. So you got to, the thing, you know, is against the commandment of thou shalt not kill, right? The main cornerstone of our civilization is don't kill anybody, right? That's the whole point, right? But let's see how she's gonna weasel herself out of it this way. Okay, so the whole point. I was talking to a lawyer yesterday, and he was saying, "Oh yeah, this the difference between the Hong Kong law and the Singaporean law is that the Singaporean law follows the Western tradition of past court cases. Oh yeah, past court cases. That's right. Yeah. So anyway, the past court cases, whereas the Chinese law, which was there was an arbitration process in Hong Kong or whatever. We were talking about international commerce. Anyway, he gets his arbitration done at the Hong Kong court, and then the Hong Kong court, if the law says this, this is the way it is. But in the Singaporean courts, oh, it's a past court's judge decision, even though it's erroneous. All right, so we're going to see how erroneous it is. All right, so there's a two-pronged test for fraud vitiating consent in the Canadian criminal law. So the Crown must prove dishonesty, which certainly did happen. So let's be clear. Dishonesty is when Dr. Michel claimed, number one, that the pregnancy, starts at implantation. That's when the pregnancy starts. There's nothing before the implantation stage. Oh no, the pregnancy starts at the implantation stage. That's when the woman is pregnant. Blah blah blah. It's false. Okay, so that's number one. The implantation starts at the conception, and there's the zygotic genome activation and all that stuff. The morula stage, the embryonic stage, blastocyst, all that stuff happens prior to the implantation. So there's a whole bunch of stuff that happens, before the implantation. So that's dishonesty, and it's a deliberate misrepresentation or material non-disclosure. Also, a number one here, that there's this, and she says, yeah, this pill doesn't this doesn't cause the death of the pregnancy because the pregnancy starts at implantation. So no, it's not. So the pill actually prevents pregnancy, but it doesn't. And it doesn't prevent pregnancy. It kills the baby at the implantation stage. So there's a certain element of this crime, which is dishonesty, a breach of fiduciary duty, gross medical negligence, lack of informed consent, whatever you want to call it. All right, so number two, deprivation, meaning that dishonesty exposed the complainant to serious risk of bodily harm. Both elements must be established beyond a reasonable doubt. Failure on either prong defeats criminal liability. So here's the problem. Okay, so that's fine, and it really did. There was not only a risk of serious bodily harm, but there was serious bodily harm. There was an early abortion, death of the viable pregnancy, determination of whatever you want to say, yeah, the death of the baby boy or baby girl. All right, so dishonesty is not the principal barrier, but it is established. All right, so where a physician knowingly misrepresents a drug's mechanism of action, first of all, the timing of the pregnancy, and then the drug's mechanism of action, particularly by stating that it prevents pregnancy while concealing its post-fertilization effects, courts can accept this constitutes dishonesty capable of vitiating consent. This prong is fact-driven and, in theory, provable. So the court's restrictive view on serious bodily harm. So Canadian courts have historically confined serious bodily harm to physical injury, disease, or danger to a woman's body itself, herself, itself, whatever, to a woman herself, such as permanent injury or life-threatening conditions. Under this jurisprudence, inducing miscarriage or terminating a pregnancy without her even knowing, without additional physical complications, it has it not been classified as serious bodily harm, even though it involves physiological disruption and loss, right? So why this interpretation is erroneous in substance? Pregnancy is a bodily condition involving hormonal regulation, uterine function, vascular changes, and systemic physiological adaptation. The forced or deceptive termination of that condition necessarily interferes with bodily integrity. Treating pregnancy loss as legally neutral ignores the medical reality that miscarriage is a physical event. So it's not a miscarriage. Miscarriage implies that it's natural. It's just certainly not natural. It's a deliberate, you know, attempt on this baby's life, a successful attempt on this baby. It's an assassination. It's a murder. It's a homicide. It's the miscarriage. Yeah, this word miscarriage. Let's not make any mistakes. This is not a a natural miscarriage that happens. This happens. Yeah, but this is not the case. Let's read this again. Treating pregnancy loss as legally neutral ignores the medical reality that miscarriage is a physical event, not merely an abstract outcome. Right? So, why miscarriage or pregnancy termination should qualify as serious bodily harm? It involves direct physical processes, uterine shedding, bleeding, pain, endocrine shock, and potential complications. Right, all this is going to come in with the help of an expert, not some lawyer, some medical doctor, like a real medical doctor. Yeah. So the ending of a pregnancy is certainly it causes serious bodily harm, right? Serious bodily harm. And they're saying it doesn't cause serious bodily harm. Oh no, the inducing a miscarriage doesn't cause any serious bodily harm. So weaseling her way out of this is the point of weaseling out of. I use the term weaseling. No insult to the animal, but it takes a real imagination to try to imagine that the termination of a pregnancy doesn't constitute serious bodily harm. Right? What kind of nonsense is that? They're going to be, oh no, it doesn't cause serious bodily harm, and they're going to look at you straight in the face and claim that nonsense, right? Well, they're not even medical doctors, and for some reason they want to keep this going, right? That's the point, right? They're going to try everything they can to keep this going, right? So why miscarriage and pregnancy termination should qualify serious bodily harm? It involves direct physical processes, uterine shedding, bleeding, pain, endocrine shock, and potential complications. It represents a non-consensual alteration of bodily function, comparable in principle to other recognized harms where organs or biological processes are deliberately disrupted. Excluding it creates a gender-specific gap in legal protection, as only persons capable of pregnancy are denied recognition of this form of bodily harm. Certainly a problem here, right? So consequences of the current approach, deliberate deception may be acknowledged, yet criminal liability fails because the harm is legally minimized. Okay. So this disconnect risks bringing the administration of justice into disrepute. What did we say about that? Oh, we can't trust the courts anymore because they're having this nonsense. It's the nonsense beyond, but they need something to weasel themselves out of it, right? That's what I'm trying to say. They need something to weasel themselves out of it because a conviction here would send the whole, house of cards toppling over, right? So this disconnect risks bringing the administration of justice into disrepute as conduct that materially interferes with bodily autonomy escapes criminal sanction due to an artificially narrow definition of harm. Right? So the core legal tension, the two-prong test is structurally sound, but the second prong is applied in a manner disconnected from biological reality. Reform, judicial or legislative, would not expand criminal law irrationally. It would align serious bodily harm with modern medical understanding and principles of bodily autonomy. Mic drop. I mean, if you really expect to be able to look at somebody in the face and say, "Oh yeah, I weaseled myself out of this one because ending a pregnancy is not serious bodily harm," and you think that you're going to be in a right? No. This one here is a legitimate concern. I don't make frivolous complaints. Right? This is a real thing. So this two-pronged test for vitiating consent, right, is it's okay, and it is serious bodily harm. But definition of serious bodily harm does not include ending terminating a pregnancy. What? I mean, that's nonsense, right? What kind of world are you living in, right? So thank you very much for tuning into how she's going to weasel herself out of this one. I'll see you. Take care. And if you enjoyed this content, please like and subscribe. I'll see you next time. Bye bye.